Well, Bill, the health commissioner revealed that the preliminary results of a serology study that they're doing in conjunction with UVA has revealed that roughly 2.4% of Virginians, adults in Virginia, have tested for COVID-19 antibodies, indicating that they may have been infected with the virus. But they say that that rate is 3 times higher in the Latinx community. Meanwhile, he says they are continuing to improve their contact tracing efforts while working to deal with the current backlog in turnaround times for tests.
State Health Commissioner Dr. Norm Oliver says the contact tracing program has been successful as they've been able to contact over 74% of Virginia's cases. He adds there are now over 1,500 tracers, but they're looking to hire up to 400 more, in part to build response teams for surges like the one in Virginia Beach.
It would take too long to hire enough contact tracers to beef up that team. And we don't want to wait. We want to back them up today.
Oliver adds they're focused on hiring more tracers who are bilingual or from a diverse background, as minority communities account for a disproportionate number of cases. But Oliver says one current challenge is the slow turnaround time of tests, up to 10 days in commercial labs. He says if someone isn't properly quarantining while waiting and it comes back positive,
we now have many more contacts we have to track down.
Oliver says the testing backlog has been driven by the surge across the country, leading to an increase in testing demand. He says a twofold approach is needed for this issue. One is to simply decrease demand by tamping down the number of cases.
There's a responsibility that we have to continue wearing masks, washing our hands frequently, doing the social distancing, physical distancing, and in that way do our part to decrease the cases.
Oliver adds he'd like to see more leadership from the federal level to bring faster testing technology to the market,
so that they can become available to Virginia and other states that are having this problem with turnaround time.
And Dr. Oliver says in the next week he expects the state to launch their latest contact tracing tool, a smartphone app. He says if people download it and opt in, because it will be an opt-in service, they will get notified if they've potentially been exposed to COVID-19. He says they'll be launching a major campaign to encourage people to download and sign up for this, saying they're aiming to have millions of Virginians do so in order for this app to be effective. Working for you in Richmond, Cameron Thompson, CBS 6 News.